Hello, my name is Tanya McMillan, and I'm a BS in nursing student at Indiana State University. The topic of my presentation today is type 2 diabetes mellitus. Type 2 diabetes mellitus, the health continuum in the African American community. Learning objectives: to define type 2 diabetes, identify ways to navigate care, identify ways to incorporate lifestyle changes to promote health, and to identify ways of educating the client and family to better understand the complexity of the illness. Over to the left, you will see that there is a pre and post test. If you would, before we go through the slide, if you would stop and take the pre-test, and at the end of the slide, take the post test. What is type 2 diabetes mellitus? Diabetes mellitus is a chronic progressive metabolic disorder with several complications that affect all systems in the human body, for instance, the heart, liver, kidneys, and brain. Being diagnosed with type 2 diabetes means that the body does not properly process food for use as energy. Most of the foods we eat turns into glucose or sugar for our bodies to use for energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin to help glucose get into the cells of our bodies. When an individual has diabetes, the body either doesn't make enough insulin or can't use its own insulin as well as it should. This causes sugars to build up in the blood. This is where the term sugar originates pertaining to diabetes. While some people can control their blood sugar levels with healthy eating and exercise, others may need medication or insulin to help manage it. Type 2 diabetes is the most common form of diabetes. African Americans are 77% more likely to have diagnosed diabetes compared to non-African Americans. Population at risk. African Americans are the population at greater risk due to factors listed below: lack of knowledge about the illness, family history of a first-degree relative, poor nutritional habits, sedentary lifestyle or decrease in physical activities, hypertension or high blood pressure, obesity, having an onset later in adulthood, or in women, having a history of gestational diabetes. Barriers to managing type 2 diabetes. Physical, cultural, and economic barriers to health behavior changes include being physically incapable due to limitations or age, a lack of transportation, like to and from your doctor's appointments or to nutritional classes, culturally conditioned to lifestyles and habits, having a high cost and low availability of healthy foods such as fruits and vegetables, a lack of motivation for change, where the client is accepting the disease state and continues to live life as it is, or trying to convince family and friends to change their lifestyles. Also, having a poor doctor-patient relationship, where there is a lack of time spent educating about diabetes, and then also being dissatisfied with the care received and having a lack of resources made available to them. Symptoms of type 2 diabetes. There are several symptoms and signs that you will see, to include frequent urination, excessive thirst, unexplained weight loss, extreme hunger, sudden vision changes, tingling or numbness in the hands or feet, feeling very tired much of the time, very dry skin, sores that are slow to heal, and more infections than usual. So if you experience any of these symptoms, please seek medical assistance from your healthcare provider or healthcare professional. Complications related to type 2 diabetes include heart disease, blindness, stroke, kidney failure, neuropathies, and amputations. Prevention. There are preventable ways to combat type 2 diabetes. There are things like incorporating a balanced, healthy diet, limiting takeout and processed foods, managing your weight, exercising on a regular basis, controlling your blood pressure to reduce the risk of heart disease and stroke, get regular healthy checkups, limiting alcohol intake, and quit smoking or using tobacco products. Conducting a comprehensive holistic assessment. So, conducting a holistic assessment allows the nurse to provide or address the six components of health, which are physical, social, intellectual, emotional, spiritual, and environmental. Conducting a holistic comprehensive assessment includes gathering information from the client with type 2 diabetes as well as the family involved with care. Getting to know the client and family is very significant because it establishes rapport as well as a relationship with them. Trust issues with healthcare providers is a real concern in the Black community. Asking the right questions pertaining to knowledge of illness and how it has affected the day-to-day living and social interactions is vital. Exploring barriers which could affect health promotion, growth, and compliance. Also addressing coping mechanisms used to deal with diabetes. Spirituality has a strong presence in the African American community and is intertwined with health promotion and illness. Living with diabetes can be very stressful due to lifestyle changes to include emotional, economic, and physical stressors. Referring clients to counselors to talk about obstacles they are dealing with is necessary, even though in Black culture, counseling is not widely accepted. Discussing treatment therapies, whether pharmacological or alternatives, is necessary and vital as well. Determining if the client is following prescribed medication orders and or if other remedies are used in conjunction with them, like supplements or herbs. Inquire if economic strains are affecting the client or household to prevent compliance. Provide resources that can assist with financial hardships for economic relief. Review laboratory findings. The A1C lab blood test helps monitor to see if treatment therapies are working. Also, assess the physical condition of the client. Look for signs and symptoms that could indicate poor health or growth and compliance, like their vision, their skin, and their blood pressure. The plan of care across the health continuum. This chart shows the health continuum from the lowest level of health to the highest level of health, which is optimal health. The lowest level is premature death, and the things in between, like on the right side of the neutral point, is awareness, education, and growth. And then on the left side of the neutral point are your disabilities, signs, and symptoms to let you know something is not right and needs to be addressed. This happens throughout the course of diabetic therapy and also promoting optimal health and wellness. The care plan continuum. So for the community health nurse, you want to have a care plan which would consist of the nursing diagnosis, the plan goals, the interventions, and also the evaluations. So if you look here, the nursing diagnosis would be deficient knowledge regarding disease process, treatment, and individual care needs related to unfamiliarity or misinterpretation of information as evidenced by verbal statements of of concerns or misconceptions. So our plan goals will be for the client to participate in the learning process, to verbalize understanding of conditions and treatments, and also to perform demonstrated procedures correctly and explain the reasons for the actions. For the interventions, we would see for us to assess the readiness to learn and individual learning needs, and also for the client to identify teaching methods that are fit for him or her, and to help facilitate the learning and also promote wellness. Then for the evaluation, we want the client to verbalize achievements of modifying factors that can prevent or minimize shifts in glucose levels, and also what can they do or identify the interventions that can prevent or reduce the risk of infection, as well as to know what the factors that could have the rise and fall of their blood glucose levels, and what can they do to make it more stable. So navigating care across the health continuum, the goal is to maintain health and wellness living with type 2 diabetes. and also reduce the risk of heart disease and stroke and other complications, as well as monitoring their blood sugar levels to know, what's good and what's not good. Also, their medication management to know how to do the proper insulin injections, what pills they are prescribed to take, and the side effects. Also, know the factors that affects the blood sugar levels, like if they ate too much or if they didn't eat enough, and to know when to seek help when the numbers just are not right. Also, maintaining a healthy weight by eating a well balanced diet, exercising, not using tobacco products, and reducing their stress level. So, ultimately, we want to educate the client and the family through face to face interactions with diabetes educational classes, nutritional support like meal planning, also having diabetic support groups, having on access to online programs, and also providing local community seminars are all ways that we can promote health as far as educating our clients, educating their families to live with type 2 diabetes and to um, get ultimate health and promote wellness in the African American community. The reference here are what I use to provide for the information that I used on the slide. You're more than welcome to look over it and to go more in depth with it. Thank you.